Let's learn about pneumonia. Pneumonia is a common respiratory infection that affects the lungs, causing inflammation of the air sacs in one or both lungs. Pneumonia can be caused by a variety of bacteria, viruses, and other microorganisms, and can range in severity from mild to life-threatening. Causes: pneumonia can be caused by a variety of microorganisms, including bacteria, viruses, fungi, and other types of germs. The most common cause of pneumonia is bacteria, particularly Streptococcus pneumoniae. Other common causes include viruses such as influenza and respiratory syncytial virus, RSV, and mycoplasma, a type of bacteria that can cause a milder form of pneumonia. Symptoms: the symptoms of pneumonia can vary depending on the cause and severity of the infection. Common symptoms include cough, fever, chest pain, shortness of breath, fatigue, and muscle aches. In severe cases, pneumonia can cause confusion, disorientation, and difficulty breathing. Treatment: the treatment for pneumonia will depend on the underlying cause and severity of the infection. Antibiotics are typically prescribed for bacterial pneumonia, while antiviral medications may be used to treat viral pneumonia. In some cases, a combination of antibiotics and antivirals may be necessary. In addition to medication, supportive care is also important in the treatment of pneumonia. This may include getting plenty of rest, staying hydrated, and taking over-the-counter pain relievers to reduce fever and ease pain. In severe cases, hospitalization may be necessary to provide oxygen therapy and other supportive measures. Prevention: there are several steps that can be taken to help prevent pneumonia, including getting vaccinated. Vaccines are available to protect against some of the most common causes of pneumonia, including Streptococcus pneumoniae and influenza. Practicing good hygiene. Washing hands regularly, covering the mouth and nose when coughing or sneezing, and avoiding contact with people who are sick can help to prevent the spread of pneumonia. Quitting smoking. Smoking damages the lungs and makes it more difficult to fight off infections such as pneumonia. Maintaining overall health. Eating a healthy diet, getting regular exercise, and getting enough sleep can help to support overall immune system function, reducing the risk of developing pneumonia. In summary, pneumonia is a common respiratory infection that can be caused by a variety of microorganisms. Treatment typically involves medication to target the underlying cause of the infection, along with supportive care to manage symptoms and promote healing. Preventative measures such as vaccination and good hygiene practices can help to reduce the risk of developing pneumonia. Let's learn about bronchitis. Bronchitis is a respiratory condition that causes inflammation and swelling of the bronchial tubes, the air passages that carry air to the lungs. The condition can be acute, meaning it comes on suddenly and lasts for a short period, or chronic, meaning it lasts for several weeks or longer. Causes: acute bronchitis is typically caused by a viral infection, such as the common cold or flu, while chronic bronchitis is often caused by long-term exposure to irritants such as cigarette smoke, air pollution, or workplace chemicals. Symptoms: the symptoms of bronchitis can vary depending on the type and severity of the condition. Common symptoms include coughing, with or without mucus, chest discomfort, shortness of breath, fatigue, and fever. In chronic bronchitis, symptoms may persist for several weeks or months and can lead to recurrent respiratory infections. Treatment: the treatment for bronchitis will depend on the underlying cause and severity of the condition. Acute bronchitis caused by a viral infection typically does not require medication and can be managed with rest, hydration, and over-the-counter pain relievers to reduce fever and relieve discomfort. If the cause of bronchitis is bacterial, antibiotics may be prescribed to treat the infection. However, it is important to note that antibiotics are not effective in treating viral infections, and overuse of antibiotics can lead to the development of antibiotic-resistant bacteria. In chronic bronchitis, treatment typically involves managing symptoms and preventing complications. This may include bronchodilators, medications that help to open up the airways and improve breathing, and corticosteroids, which help to reduce inflammation in the airways. Prevention: There are several steps that can be taken to help prevent bronchitis, including quitting smoking. Smoking is a major cause of chronic bronchitis, and quitting smoking can help to reduce the risk of developing the condition. Avoiding lung irritants. Avoiding exposure to lung irritants such as air pollution, secondhand smoke, and workplace chemicals can help to reduce the risk of developing bronchitis. Practicing good hygiene. Washing hands regularly and avoiding close contact with people who are sick can help to prevent the spread of viral infections that can lead to bronchitis. Getting vaccinated. Vaccines are available to protect against some of the most common causes of bronchitis, including influenza and pneumococcal bacteria. In summary, bronchitis is a respiratory condition that causes inflammation and swelling of the bronchial tubes. Treatment typically involves managing symptoms and addressing the underlying cause of the condition. Preventative measures such as avoiding lung irritants and getting vaccinated can help to reduce the risk of developing bronchitis.